Hello everyone, today I'm going to be talking about esophageal carcinoma and I will be going into detail. So it is a very important topic and I say this because at present it is the sixth most common cancer globally. So regardless of whether you are studying medicine or practicing it, you are very likely to come across a case at some point. So we are going to look over the risk factors. We are going to take a brief look into the symptoms, the diagnosis, the differentials, the management, and I'm also going to throw in a little bit about the operative complications. So to find out more, stay tuned. So when talking about esophageal malignancies, we are basically talking about squamous cell carcinoma and adenocarcinoma. Broadly speaking, squamous cell carcinoma tends to affect the upper 2/3 of the esophagus, and adenocarcinoma tends to affect the lower 1/3. Now, while squamous cell carcinoma tends to be the most common histological variant, adenocarcinoma has been on the rise. It's been postulated that the reason for this is due to the increase in Barrett's esophagus. But don't worry, we'll get into that later. Really, both of these could technically be talked about in separate lectures, but there is a lot of common ground between the two. So we'll crack on. Now, so like I mentioned, since we have different histological variants, it shouldn't surprise us that they have slightly different risk factors. So for squamous cell carcinoma, smoking, alcohol, nitrosamine diets. Now, what I mean by nitrosamine diets, we're sort of talking barbecued food, processed meat, or beer actually. Vitamin A, C, and other deficiencies can also contribute. And it's an interesting fact, the area of highest incidence is actually a province in China, in the Henan province, in a place I think that they call Linxian. I'm not sure if I'm pronouncing that correctly, but they started supplementation of beta-carotene, vitamin A, C, and E, which, mind you, are the antioxidants along with sort of selenium and zinc. And they actually found a decrease in the incidence of esophageal carcinoma, squamous cell carcinoma in particular. Pre-existing disease can also lead to it, such as anatomical diseases such as achalasia, costic strictures, gastrectomies, and people with atrophic gastritis. It's all associated with an increased risk of developing esophageal squamous cell carcinoma. There has been some mention of celiac disease as a predisposing factor to squamous cell carcinoma. Tylosis, which happens to be a rare autosomal dominant syndrome that's associated with non-epidermolytic palmoplantar keratosis, or Howell-Evans syndrome. And it has a strong association with esophageal squamous cell carcinoma and actually carries a 40 to 90% risk of developing cancer by the age of 70. And of course, let's not forget human papillomavirus. Now, adenocarcinoma, the risk factors for that include obesity, high fat intake, high alcohol intake, smoking, and gastroesophageal reflux disease. And so that's often associated with things like hiatal hernias or loss of the sphincter tone. And Barrett's esophagus. I mentioned this slightly earlier in the talk. Now, Barrett's esophagus is basically a metaplastic change in the mucosal cells that line the lower portion of the esophagus. And so they go from their normal stratified squamous epithelium to a simple columnar epithelium with interspersed goblet cells. And so that happens when you have chronic acid exposure from reflux esophagitis or GERD, as we mentioned earlier, or often, actually, interestingly enough, happens to people with prolonged exposure to hot drinks. So make sure you drink your tea cold. So now that you know a little bit about what can cause carcinoma of the esophagus, stick around with us here on sqadia.com as we move on to the clinical symptoms.